on the record this
You got it.
meeting?
It
Yep,
shows that it's being recorded.
Yep, okay, good. Thank you for that.
No problem.
And let's see, Paul Frida. I don't think his mic is active yet. Let's see, whoops. Hey, Paul. Paul Frida, are you muted? I guess we'll give him some time. Well, I guess as long as I've got a few of you on here, let me start with Jake. Do you have anything you want to talk about?
Well, I don't know how much we can talk about, but I'm a little bit bummed because I found out I went to my oncologist the other day for my Lupron shot, and my PSA is now up to 5.5. It went up 2 whole points since August, or since September. It went up 2 points in 1 month.
Oh, well, sorry to hear that, but okay, yeah, we definitely want to hear from you when everybody else is on.
Okay.
And Jim Harrington, like to
yeah, thanks, Lynn. I guess I'd like to ask a question. Yeah, put me on.
Sure, okay. I think Rick usually likes to give this at least 5 or 6 minutes, right?
Yeah, he normally does, and then he does a head count. Doesn't sound like very many people popping on though.
Yeah, well, maybe knowing that Rick wasn't going to be here, they decided they'd pass today. That's what I told Rick. You know, it might have been wise just to cancel it, but he wanted to go ahead with it, so I guess he feels he might make it. And Paul, we still haven't heard from you. Okay. Paul, check your settings. You might be muted. Do you guys, Jim and... Yes. There he goes. Hi, Paul.
Yeah, I'm purposely muted because I didn't want my, you know, what's going on here to come in. But yes,
that's fine. I just wanted to ask you if you wanted to, if you had anything you wanted to talk about.
Oh yeah, right. I got to check in. Let's see. Let me think. Yeah, I do. But when you come to me, I'll think of what it is. Okay.
Sure.
Yeah. Okay.
That sounds like me. I can't think what I want to say until it's too late. And then I have to, oh yeah, I wanted to say this.
Write it down, guys. That's what I do.
We've all had moments like that, haven't we?
Yeah, for sure. Thanks to ADT.
Yeah.
Hello, Albert.
Hey, who's that?
This is
Jake?
Len. This is Len.
Oh, Len,
I'm fine, thanks. I'm subbing for Rick while he's in the UK having dinner with some friends, and maybe he'll be able to join us later.
Hey, you know your cams are off, by the way. I don't know if that's what you wanted it, or...
You can't see me?
No, I show you Len, Jake, and Paul both have their webcams turned off.
Oh, okay, hold on. I have to share it.
No, you know, that's okay. I wasn't sure. There you go.
That's me.
My cam is off.
Yeah, you guys don't have to have it on if you don't want, but Rick suggested that as a presenter I should have mine on.
Hi, Albert. This is Jake.
Hello.
How you doing?
Good.
Thank you for sending me that information, by the way.
Oh, you're welcome. I wanted to get some more stuff, and I've just been so busy at work that I haven't had a chance. But I hope to get to it this week. It was some really interesting material.
Okay.
So, Albert, is there anything you want to talk about today?
I had my second bout of chemo. Went good, but then, and I forget what shot they give me to increase my blood count, but that kicked my butt this weekend, so I found out some stuff that I might be able to share with the group.
Great. Sure. Appreciate it.
You know, this is the first time I've ever seen you, Len, I believe. You're an awfully young guy.
No, looks are deceiving, Jim, because I'm actually 67.
Really?
Yeah, I know. People...
That's for 30. Honestly.
Oh, no, wait, no. That must be the camera or something. But people do tell me I look at least 10 years younger.
You must have lots of filters and gauze mesh over the lens and everything, huh?
Yeah, that's it.
Using a Hollywood trick?
That's right. And you know, I got my my injections this morning. You know, no, not really.
Your Botox.
Botox, yeah. You can tell by that. I can smile big that I'm not paralyzed in my face.
There you go. But you can't blink. No, you do really look very young.
Yeah.
Don't you think, Albert?
I can't take credit for it. I guess it's genetics. My mom and dad always looked 15 years younger than they were.
Wow. Congratulations. That's nice.
Yep. Thank you. Yeah, this is the first time I've ever had my webcam on. I don't usually have it on.
Yeah, I don't either normally. I use the webcam. I try to, my computer, the microphone on my computer is not that great, and the camera is horrible. So I do hook up my webcam, but I usually just use the sound.
Yeah.
Nobody wants to look at me. Plus, I do naughty things while I'm on, and I get Rick will yell at me if I do. I smoke.
Yeah, I got to be careful.
You smoke too?
Well,
anyway, Rick would yell at me if I smoke probably, so that's why I usually turn the camera off. My secret's out.
Does anybody else? I hate wearing this headset because my ears get so hot. Does anybody else experience that, or is it just me?
I don't use a headset.
Oh, so you're just using your speaker, computer speaker audio?
Well, actually, I have a again, this is a laptop, so the speakers aren't that great. What I have a cooling pad for my laptop to keep it from overheating, and it actually, the one that I bought recently, just includes built-in speakers, which is pretty cool.
I always thought that if you...
Right, I use this, and it helps out a lot.
Oh, yeah.
I don't know if you can see it or not.
Yeah, I do. So you have kind of like earbuds that you attach to your
it's
headset?
a Bluetooth device.
Yeah.
Works with a phone, works with my computer.
Uh-huh.
And because I'm always sweating because of the Lupron injections. So
Yeah. That's pretty cool. Yeah, that's what I've got to get. Are they expensive, Albert?
Pardon?
Are those... was that expensive, that device you just showed?
No. They were less than 100. I say $25 or $30 at the most. So.
Yep. Okay. All right. Let's see.
I got them at Sam's Club, and pretty good. They may have been 60. I don't know, but it's really nice.
Yeah.
Or like this cooling pad that I have, I think I paid $40 for it with the built-in speakers, and it's working so far. It's good sound. I can listen to music without headphones, because like you said, they get sweaty and they get uncomfortable after a while.
Right.
So, so far I'm happy with it.
Great.
Yeah.
Well, let's see. It's 6:11, and I think we might as well get started. I don't know how late people join. I don't think they join much later than this. So let's see. Right. Why don't we start with Jack? You want to start, or you want to let someone else? Up to you.
Who?
Jack Hannum.
Oh, Jake.
Oh, Jake. I'm sorry. Yes, Jake.
That's right. Well, it's not really a whole lot to say, other than I got my every 4-month Lupron shot the other day, and they always take my blood results that day, so I don't have to make 2 trips. And I got the results yesterday, and it's gone up from, it was 3.5 in September, now it's 5.5, which is like at that rate, it's doubling every 2 months.
Right. And what was the PSA doubling time up till September?
Well, I don't know. I have never actually calculated that. I always calculate the percentage of increase from month to month in my in an Excel spreadsheet. So I'm not sure how to calculate doubling time, but it's been going up significantly every month for the last 6 months. But this is the first time it actually went up 2 whole points.
And since I don't have Rick's database of everybody's history, could you just give us a quick summary of you know, from diagnosis with Gleason score up to where we are now?
Okay. Well, in July 2010, I had focal cryotherapy. I had a biopsy to identify Gleason 8 in about 3% of my prostate, and Gleason 6 in about 60% or 40%. So I opted for, and it seemed to be all on one side, so I opted for focal cryotherapy, where they just froze the one side. Which we thought at the time was a good option because bone scan, the MRI did not show any metastases.
Right.
But my PSA kept going up. You know, every time I go back to the urologist, it was going up, going up, going up. And finally, two years later, in June of 2010, I decided I was going to get rid of the urologist and went to an oncologist. So she sent me for a PET scan because I was having some symptoms. And the PSA rising consistently obviously meant that they hadn't gotten all the cancer. So she sent me for a PET scan, and sure enough, I had bone mets in my sacrum, my ilium, several in my spine, some in my right hip. And so she started me then, June of 2012, on Lupron shots every 4 months and monthly infusions of Zometa, zoledronic acid.
Right.
And that's what I've been doing for the last 4 years and so many months. About a year ago, or about 9 months ago, she started me on bicalutamide because my PSA was going up a little bit, and it was keeping it down.
Right.
The lowest it ever got was 0.5.
Okay.
It never went lower than that. But we were both happy with that.
Sure.
So, and now I'm up to 5.5.
Okay, so it's been going up steadily for months. I'm surprised she didn't they usually take you off Casodex or bicalutamide, and first of all, see if you have a response to that alone. Sometimes that alone will bring down your PSA, and if it
it did. The bicalutamide did bring it down. It had risen before that, so the bicalutamide definitely made a difference.
No, what I'm saying, Jake, is that sure, you were responding to the bicalutamide, but when you stop responding, when the PSA is going up like it has been for you, what they usually do is stop the bicalutamide, and sometimes when they stop it, they actually see the PSA go down. And the reason for that is that bicalutamide is both a receptor antagonist, so it blocks the receptor, but it's also a weak partial agonist, which means it can stimulate the androgen receptor on the prostate cancer cell and cause it to the cancer to grow. So sometimes they find that when they stop the bicalutamide, the PSA actually goes down.
Okay.
So are you still taking the Casodex now, the bicalutamide?
Yes, I am. Yeah.
Huh.
I'll have to ask her about that. Again, like I said, she takes the PSA right before she gives me my Zometa infusion.
Right.
That way they can take it out of the same vein without numerous pricks. So it's always after the fact that I find out what my PSA is. So I won't see her again until next month, but I'll certainly ask her about that.
Yeah. I mean, if it were me, I'd be a little uncomfortable just staying on the bicalutamide while it keeps rising month after month. So I think normally they stop it, like I said, see if there's a decline in PSA. And I think whether there is or not, they will still put you on the next level of hormone therapy, which would be Zytiga or Xtandi.
Right.
Yeah. Has she talked to you about that at all?
She mentioned Adirone a while ago, and then we talked when I went in the other day. We talked about Xtandi, and I told her that my concern with that is the expense. And then she talked to me and said, "Well, we go through the patient access network, I believe it is. I think that's what it's called. And is that the right term? Patient access network for funding or for financial assistance.
Yeah.
So she's working on that now.
Okay.
So I think my next step is obviously. She did tell me, when I first started, that her threshold is she likes to use she uses a threshold of 10. She doesn't really try to change any pre-treatment until it gets up to 10, because her philosophy is spread it out as long as possible, each treatment as long as possible.
Right.
And I agreed with that at the time. We were both on board with that. So, and I think that's probably what she's doing now.
Okay.
So I'm not concerned. I don't have any additional pain. I've had back pain for several years, and I take oxycodone twice a day just to keep it kind of under control. And that's so I'm not having any increased pain. I don't feel any worse than I did. So.
Okay.
Yeah, I will talk to her about stopping the Casedex. I might even call her now that you mention it.
Yeah,
Thanks.
I wish you would. I'd feel better about that.
Yeah. I knew that, but I had forgotten about it. I was so upset about the PSA going up, I had forgotten that dropping Casedex sometimes does help. I may just call her tomorrow. Thanks, Len.
Sure. Jim, Paul, Albert, anybody want to chime in? Any advice for Jake?
When I had the bioclutamide, my doctor stopped it for a month or two to see if there was any impact. So your advice isn't unreasonable.
Uh-huh. How did it work for you when they stopped it?
It still kept going up.
Oh, okay.
Didn't make any.
My cancer is one of those strange ones. You give it all this stuff, it says, yeah, feed me more. So.
Mm-hmm.
Did you have to wean off of that, Albert, or did you just stop taking it?
No, just stop taking it. He said, okay, stop it, and I did. I still have a bottle here. And
I may stop taking it on my own.
yeah.
Just to see if it makes a difference.
Yeah, well, of course, it's always a good idea to let her know that you're doing that.
Well, yeah. I just wasn't sure if it was one of those ones you needed to wean off of,
No, absolutely not. That's not one of those things that you need to wean off of.
Okay. Were you ever on it, Len?
I wasn't, but I mean, I do have a pharmacology degree, so I know about a little bit about these things, and I know there's no need to wean you off of that particular drug.
Okay.
Okay. Anything else, Jake?
No, that's it.
Okay.
I've talked more tonight about myself than I have in the last 2 years.
Yeah, I know you usually pass.
Yeah, I usually, I figure my problems are very insignificant compared to some of the other callers. So.
Yeah.
And I still think they are. I mean, compared to some of the other callers, and my PSA is still low. I'm not in too much pain, so I feel guilty talking about myself.
Sure.
Yeah, you should be. That's what we're all here for.
Yeah, that's true.
Well, I did tonight, so thank you for the input. I definitely appreciate it.
Okay.
Len, this is Jim Harrington. I was on Casedex for about 3.5 years, and it was working more or less. I was on triple dose Casedex, and I stopped it. But you're quite right. You can stop it cold turkey. There's nothing that I felt different. I started on Lupron. I've been on Lupron, and I'm on Lupron for life and Xgeva. But what I would say is I do realize that the second-line hormonal therapy, Xtandi or Abiraterone or Zytiga, are expensive. I was on Xtandi for a while and I failed it, and that was over $9,000 a month. And now I'm on Zytiga, and it seems to be working, although my doctor says it won't very long. But putting that aside for the moment, it's a bit over $8,000 a month, but my insurance covers it. But I guess the point is, if there's a way to get a third party to cover it or get help from the drug maker, it probably could do you a world of good. I mean, Xtandi is a super Casodex, if you want to look at it that way, in some ways. And so that might be that you responded to Casodex. And in my case, it didn't work. I don't know if it's because I was on Casodex so long, but it didn't work. And so I'm on Zytiga, and it's working for the moment. But you got to hope those second-line drugs work. They're pretty good drugs, but the cost is, yeah, it's a shocker. If you had to pay this out of your pocket. Unfortunately, I don't. Insurance covers it, but it's something to really investigate because it's what's going to ultimately be something you're going to turn to. I mean, there's almost no way around it, and hopefully it'll work for you as long as possible.
Well, the expense is one of my concerns. I'm retired.
Well,
I'm living on a fixed income. And my insurance only covers. I have Medicare, but that they cover no drugs whatsoever. So I have Blue Cross and Blue Shield through my work, which I've continued for since I retired, and not mostly because my wife needs it, but I also use it because it does pay 80% of my drugs. But 20% of $8,000 is just that's more than I bring in a month. 20% of that. So that has been my big concern is the expense. What insurance do you have, Jim, that pays all of it?
Well, I'm fully employed, and the state of New Jersey, where I work in New Jersey for Rutgers University, and our medical insurance is very good. I mean, I guess Governor Christie hasn't decided to whack away at it, and they pay it all. I kept full coverage on Xtandi or full coverage on Zytiga. We have one of those guys in S2, and he's on Zytiga, and it's paid for by, I think, the company or somebody is held out a hand to him to cover it, and he gets it covered entirely. And at the moment, I don't know where he goes to get it done, but I would try, going to the company, you go to their website, and you can see that they are able to give you some help. But I am fortunate. I am fortunate because I'm fully employed, and I have Blue Cross Blue Shield and a prescription plan, that I'm fortunate that covers it. I'm on Lupron for life, Xgeva for life, and you throw these drugs in, and I've got bills of over $120,000 or $30,000 a year, which I don't pay.
Well, yeah, you're very fortunate.
That is fortunate. But I know you can get some help. Rick would be better probably, or Len, or somebody than I am to know how this is. I don't have to worry about it. But say, one guy in our S2 group, he's getting Zytiga for nothing, and I just don't know how he did it.
Yeah, unfortunately, I'm not very knowledgeable about different insurance plans, so I can't help you much there, Jake. But I mean, it sounds like you don't have Medicare Part D for prescription.
That's correct. I don't. I just have Part A, which you have to get. I do not have any prescription.
No, I'm talking about Jake, though.
Oh, Jake.
I don't.
That's good.
I have Part A and B, and I don't have Part D because the secondary insurance, Blue Cross, does make up the difference for most things. And I've been looking, right now is the open season for Medicare, and I have been looking at the Part D plans, but all of them are very similar to what I already have with Blue Cross. They pay, they have so much copay up to, but my copay would be anywhere from 20 to 25 to 30% with any of those part plans. There's none that I could find that pay 100%. So I think my Blue Cross is equivalent to any Part D plan. So it's just that because Medicare covers nothing, Blue Cross pays 80% after a deductible, and then I'm stuck with a bill. So
right.
Believe me, right now is the open season for Medicare, and pretty soon for the federal insurance program that I'm also part of, and I'm looking very hard, but haven't been able to find anything that will cover it 100%. So my option is, and we have talked about this on this site before, Len, is Rick has mentioned the Patient Access Network. I think it's called PAN, and he's talked about working directly with the company that manufactures it. So I will, but they won't talk to you until you have a prescription.
Uh-huh.
You know, the first thing they're going to know is, do you have a prescription for the Zytiga or Abiraterone? And until I do, I can't really talk to them.
Gotcha.
But
Okay.
I'm hopeful. I'm hopeful. I'm definitely, I think that I'll be able to get some kind of financial assistance.
Very good.
But thank you all for the input.
All right. And I see Paul Hobson joined us. Paul, do you have anything you want to talk about tonight? And you appear to be muted. There you go.
There you go.
Hi. Sorry, I was up the other end of the computer and madly trying to get back to unmute. No, just listening tonight. Thanks.
Okay, great. Welcome aboard. All right. So, Jim, would you like to go next?
Sure, Len. I just have a question for anybody on the call that might just give me a little help. Basically, my PSA is still reasonably low. It's about 1.5 or something like that. But my question is, if any of you had bone pain, I have bone mets. I suspect it's in my hip too, but it's mostly in my spine. And I'm just wondering, I know this may sound like a funny question, but if you have had pain due to bone mets, can you describe the pain? Is it all the time? Is it worse in the mornings? I'm just curious about back pain.
Jim, this is Jake.
Yeah, Jake.
I also have, I don't know if you heard what I said, but I have bone mets. You did.
Yeah.
I do have it in several spaces or places in my spine, and I've had pretty consistent lower back pain.
Mm-hmm.
It's not debilitating. It doesn't interfere with my walking or anything, but it's always there.
Is it there in the mornings more than the night, or is it during the night when you're sleeping? It's there.
Well, one of the things I do is I take oxycodone twice a day.
Oh,
I take
see.
one,
Yeah.
I take
Okay.
one when I get up, and then I take one before I go to bed, and that does help.
Okay.
It kind of takes the edge off, as they say.
Uh-huh.
I have noticed that it's worse at night when I'm trying to go to sleep. It's starting to keep me awake.
Hmm.
You know, I don't do anything strenuous. So I'm not an exerciser, and I'm retired, so I don't have to work or anything. And I can move around, to get comfortable as much as possible. But I do notice it's worse in the evenings, and I also have problems sitting. If I sit for like my sister will come to visit, sit at the table drinking coffee and talking, and after about an hour I've got to get up and move because I'm just starting to get uncomfortable sitting there.
Mm-hmm. The only pain medicine you take is oxycodone?
Yes.
Okay, I sometimes experience a bit of back pain, but it seems to be getting much better. I've never had back pain, but I've certainly I know I've had bone scans, and it's there. Right. And sometimes I started off with one bone met right about in the middle of the spine, about T9, and they had it radiated, but it didn't do any good because it's like whack-a-mole, and they just appeared elsewhere. And so I've stopped any radiation or any hope that that's going to help my bone mets. But I've been having a little bit of it, but it's getting better, and I'm not sure it's because I do exercise. I do lift weights. That sometimes I have a little bit of back pain, but it's mostly gone away. Sometimes actually my doctor here in New Jersey is somewhat surprised I don't have more back pain. When I had the bone met, just one, he said, you don't have any pounds on my back. He pounds right on T9. And I guess he figured I'd go right through the ceiling, but I don't feel anything. But now I'm beginning to wonder, because there are more bone mets, what the pain is like. And it seems to me it would be pretty consistent throughout the day and night. And that's what you're describing. And so I don't know if my little bit of back pain, which I'm getting, which is getting better, is due to that or just due to my exercising.
Well, it could very well be the exercise is helping. Yeah,
I think so. I mean, I've been lifting weights for many, many years, and yeah, I don't lift as much as I used to because I'm 74. But on the other hand, I'm thinking that that's what I must have done, because it was really bad about a week and a half ago. But now I hardly feel anything. So I'm assuming that's why I asked you about back pain, and you answered the question. I appreciate it, Jake.
Sure.
I don't know. I mean, all I would do is say, Jim, just go get another bone scan. But I don't know what it's really going to show. I mean, pain's pain, you know, but I don't take anything for it. I don't take any oxycodone. But I appreciate what you said.
Well, you know, you know, all of us, you know, as we get older, I think we start having aches and pains, you know.
Yeah, yeah, I think so.
If we didn't have cancer, we probably wouldn't think much of it and say, well, we're just getting older.
Yeah,
but,
right. Now you get it and you think, oh my God, you know, it's due to that. But
is it the cancer, right? So
yeah,
I
is
asked
it the
my
cancer?
doctor. I asked my doctor about that, my oncologist, and she said no. She said that the first thing she asked is it a steady pain? And I go, no, it comes and goes. And she goes, well, then it's not cancer. If it's pain cancer, it's going to be pretty much all the time.
All the time. That's what I would have thought. Well, thank you for that. That's what I think too. I think I can. I'm not going to say I see my oncologist on Monday, but I don't think there's any point in mentioning it. I mean, I know we've got a guy in us too, and he first discovered his prostate cancer when his PSA was 640.
Wow.
But it's his own fault, yeah. And then he was in so much pain, and then he told him he hadn't said he's been on chemo and so forth. But you let it go that long, and you know that can happen. So, but right now, I think one thing I find is on Zytiga or Xtandi, you can look at the side effects, the numerous ones, and I do experience some joint pain, particularly in my knees. But you can live with it. It's not bad, and try to walk around a bit and so forth. But that does occur, and I also take metformin. I've often talked about this on this call, right. And you know, it's anecdotal that it works, but it's okay with me. I don't care. Anecdotes are fine with me. I'm taking it, and it's a great appetite suppressant. It really, really, you know, Lupron puts it on, and metformin takes it off, and anyway, I don't mind that part because I have no side effects of metformin. Whether it's doing anything for me or not, my PSA did drop on Zytiga, so I don't know, maybe.
Well, I'm like you. I'm on metformin too. So I'm on a low dose, but it does.
How many pills are you taking a day, or
just one?
One, yeah. I start out at 3 and I drop back to 2, but I mean, you can take a dose of 4 of those things, which is 2 grams. But would you have any idea whether metformin's working, or are you just taking it because you're like me, you've heard it could work?
Well, I'm first of all, I'm pre-diabetic, so I was able.
Oh, I see. Oh, okay. Yeah, then you take it. Yeah.
In the first place.
Yeah, that's true.
I don't think it's made a difference as far as I don't think it's hurt. And I have lost weight, like you said. I have.
Yeah. It's boy, the second day I was taking it, boom, my appetite went down. So, actually, I don't mind it at all. You got to watch that your blood sugar, but I don't know. I like a good cookie now and then. I don't have any problem with my blood sugar. So.
Right.
But anyway, yeah, it's interesting. I hope that sometime some testing, which I gather is going on, or some trials maybe, will show that it works or doesn't work. But at the moment, it's certainly a very benign, in my opinion, drug.
Yeah, well, I agree. It's cheap and it can't hurt. We've talked about this before. You know, it would be nice if there were some studies because a lot of doctors will not prescribe it unless you're diabetic.
Oh, absolutely.
You know, my oncologist kind of, you know, she just kind of looked at me funny when I said I was taking metformin, but my regular doctor approved it.
Yeah, I got my oncologist to approve it, but he wasn't against it. He said, okay, you want that? I'll give it to you. But my colleague at Rutgers, who has pretty much the same condition I have, I think I'm a little bit further advanced, he goes to Sloan, and he has that really famous doctor who's at Sloan, and he won't prescribe it. So
right.
It could happen. And
they tend to be pretty conservative.
It's Share. Yeah, he's very famous and very good. But go to somebody else then. Go to your general practitioner or something to try to get it. So.
Yep, that's what I did.
Actually, there was a study just recently released. I believe it was from University of Pennsylvania, where they did trace that the prostate will produce its own cholesterol on a different pathway. So they're starting to look at that and doing studies to. They did it in mice, and with the mice it cleared up. But you know, from mice to people is different. So.
Yeah, those, yeah.
Well, metformin doesn't attack cholesterol, though, Albert.
Yeah,
right.
Yeah, I don't think so.
Statins.
You're speaking of statins, yeah, which also Dr. Steve, I think, says he takes those too. I forget what.
He does.
Just because it's anecdotal, it'll work, and if it's anecdotal, I'm taking it. I don't take statins, but it's a thought. Yeah, but that's right. They hit the cholesterol. So
Yeah, he takes Crestor, I believe.
oh, okay.
But yeah, I take a statin also, but I do have high cholesterol. Yeah.
Oh, okay. Yeah, I don't. I don't suffer from that. And some things are good, you know. So, well, thank you, gentlemen. I appreciate your comments. I know this is a small group tonight, but we're all in this together, and we all have some serious problems. So.
Yeah, Jim. If I was you, if you're going to see your oncologist, I would ask him or her about the pain, though, because it's,
yeah, I think I will tell him. It's always good to tell him, and
Yeah.
even if he says we'll go get another bone scan, I'll do it. I don't mind them particularly. Maybe they can glean something from another bone scan. But that's right. You shouldn't keep it from your oncologist. That is a very good point. Tell him, and yeah.
Well,
will.
hopefully he'll confirm what my oncologist said to me, that if it's a steady pain, cancer pain is steady, any other pain is usually not. So it would be nice to hear somebody else confirm that.
Yeah, it would be. It would be. Yeah.
Yeah.
Good
Paul
point.
Hobson here. I've had bone pain, find it probably worse at night. I find mine varies a bit. Some days I can go without the need for pain relief. Other days it seems to be, kicks in and is a bit stronger. I don't know for what reason, and that I do need pain relief. I was on Zytiga, and within days of starting Zytiga, the bone pain went, which made me suspect that the Zytiga was working. So
Yeah,
I had a period on Zytiga without bone pain, and when the Zytiga failed, the bone pain came back again.
Interesting.
What's your PSA, Paul?
99 at the moment.
What are you on? Are you on? Have you tried Xtandi or enzalutamide? Or you haven't tried that?
Because I've failed Zytiga, there's a possibility from the studies that if you fail one of those two, you're probably likely to fail the other.
Yeah, so I've heard. Yeah.
So I'm tending, because of that, to leave trying Xtandi till later on. After the Zytiga, I went on to Docetaxel Chemotherapy.
Oh, I see. Did that work?
No. And I'm now on Cabazitaxel.
I wish you well.
Yeah.
Thank you.
Docetaxel didn't work at all?
No. What happened was my PSA kept going up after I started the chemotherapy. What happens is you can have a flare after you start docetaxel, and the PSA can keep going up, but that normally only goes up for 3 treatments. Mine kept going up beyond the 3rd treatments, and a bit peculiar, I then got a few slight drops in PSA, but my oncologist felt, going on the on the 3 signs test, that it was probably better to give up the docetaxel. What happened was I had progression on scans, and I had bone pain, which was increasing. The fact that the PSA had dropped back marginally after the 4th treatment, he felt sort of 2 out of 3 of the indicators were negative. So rather than persist with the docetaxel, we then changed.
How's the cabazitaxel working for you so far?
I've only had one. I've only had one treatment. Ask me that in about 3 weeks' time.
Great. Have you had any side effects from it so far?
I've found the cabazitaxel much more tolerable than the docetaxel.
I've heard the same thing. Which is a little bit strange because, you know, it's always docetaxel is first, but a lot of people have more side effects than they do with the cabazitaxel, which supposedly is a stronger, more potent chemo. And it's kind of counterintuitive that the stronger medicine has less side effects than the weaker one.
You know, well, certainly finding it easy. Whilst I didn't have that many problems with the docetaxel, there are just less incidences of the side effects and so on. But with the docetaxel, they check you on your first few treatments to see whether you are likely to have a severe reaction. I didn't have a severe reaction on the first and second docetaxel treatments. I had my severe reaction on the third docetaxel treatment, and sort of started being unable to breathe and so on. It was quite interesting to see the emergency team go into action, and the sort of efficient way it was done. I felt very confident that all was going to be well. My wife, who said, you know, I was stopping breathing and my eyes were rolling back in my head, was less confident. But that was just strange to have it the third time, and the subsequent times they gave me more pre-meds to make sure that I didn't have a severe reaction. They sort of start on the basis, sort of don't give unnecessary pre-meds if they're not needed, but once you've had an adverse reaction, they then give you...
Gary, that just all of that scares me to death.
But
they were
having
the medical guys were able to reverse it immediately.
Once they got me on some oxygen, and also I think they put an antihistamine injection or something into me. Once they got the injection in and the oxygen on, I normalised very, very quickly. And as I said, just the sheer professional way that they went, they got onto it very quickly and solved the problem very quickly. My interest was more sort of sitting there saying, "Ah, yes, you know, I'm starting to be able to breathe now. This is good."
Breathing is
so having been through the experience, it wasn't all that, even having a severe reaction wasn't all that bad.
Sounds pretty bad to me. That scares the shit out of me.
Yeah.
Excuse my language.
Yeah, it sounds like
It did out of
an
my wife.
allergic reaction rather than the typical kind of chemo reactions that people have.
Well, the reactions are an allergic reaction. The body just says, "I don't like this stuff."
Right.
No.
And cabazitaxel is a fairly closely related drug, so I can see why they wanted to test you for sensitivity before they gave you that one, because they're both considered taxanes, a certain type of cytotoxic drug.
No, I understand they're similar, and so with the cabazitaxel, they gave me full pre-meds before they started them.
Right.
And also, at any time when you're starting chemotherapy, the first couple of sessions, the chemo nurse will sit with you for the first 20 minutes, half an hour of the treatment, just to make sure that they're there if you have a reaction. Part of my problem was that it occurred on my third treatment when I didn't have someone sitting next to me, and it took a bit longer for them to get started on me. So all good.
It happened right while you were in the doctor's office. It happened then.
Yes.
Oh, okay. I was thinking it happened, 2 days after you had it and you were home alone or something.
No. What happened was within sort of minutes of administering the chemo, started to feel unwell and had a reaction, and then the crisis team arrived. But that's it happens, but as I found out, easily reversible.
Good to know.
Say, Paul, you said that failed Zytiga and you didn't want to start Xtandi right away. Did you have the test for ARV7, or is it available in Australia, which is where I assume you are?
Sorry, yes, I'm in Australia. The test probably is available. No, I haven't had it. Going through with my oncologist, felt going to the chemo was probably the way to go, rather than have a test for ARV7. That option of Xtandi is always there at a later stage. So that's just a decision made about what's more likely to work rather than not work.
Right. Okay.
One thing that I was looking at after the Zytiga, there's a clinical trial in Australia of lutetium-177, which is a radionuclide which sort of gets delivered right to the site, and unlike radium-223, does both soft tissue and bone. Unfortunately, they published an article in the papers about how good this clinical trial was, and after months of struggling to fill the trial, the thing filled up on the morning of my appointment with my oncologist, so I missed out by a day, which I'm a little pissed off about, but that's something that may try later on down the track.
Right. Yeah, I've heard it has the potential to be better than radium-223.
The experience that I've got a number of friends who've been on the trial, the experience is that it can get rid of all the mets and people come up quite clean, but it tends to come back again, so it's more a delaying tactic, or that's what they're finding so far.
Right.
Can you repeat what that is again? Maybe spell it.
The chemical symbol, for starters, is L for Lima, U for umbrella, 177, and it is LUTETIUM.
Okay. I'll have to look that up. Thank you.
It's not available in the U.S., Jake.
Figures.
They are.
The English and the Australians are always ahead of us for some reason.
In Australia, we have the opposite opinion. This lutetium actually came out of Holland, Germany, and there's now this clinical trial in Australia. There's a conference in about weeks actually in Australia on lutetium and other radionuclides, and there are quite a number of people from US hospitals and cancer centres who are speaking at the conference and I think involved in trials.
That's a familiar story that treatments coming out of Germany, they have public financing of medical research, and so when they discover treatments, they patent it, but they allow anyone to use the patent. So of course the problem in the US is that that's not the type of healthcare system we have, and so companies that might wish they could use lutetium-177 or one of the newer scanning techniques called Axumin, also discovered in Germany. There's no profit motive in the US, so they tend not to adopt it here.
Wow.
Kind of unfortunate.
You answered my question. I was going to ask, why isn't it available in the US? And that pretty much sums it up.
That's it, yeah. It's basically not patentable in the US.
But you can't, even though it's not patentable, you cannot get it here?
Right, yeah. You'd have to go to one of the European countries or Australia where medical research is publicly funded, and they don't need a profit motive, and it's available there.
As I said, I think there are some trials going on in America at the moment.
Yeah, it's possible that some American companies will find a way to tack on a few bells and whistles to create something that is patentable, based on the research that was done elsewhere. That's about the only way it gets introduced here. That's my understanding anyway.
I mean, something that works on soft mets and bone mets simultaneously, you would think that that'd be a groundswell of support for that, regardless of the patent issue, and the profit-making issue. You'd still think that the medical professional would be pushing for that. At least I would think that.
Yeah, I would think the same, because after all, the great cancer centers here in the U.S., they're nonprofit hospitals, the university research hospitals. I don't see why they couldn't implement it.
I'm going to look it up anyway and see if there are any trials, because that sounds very promising.
Mm-hmm. Certainly is.
Well, hopefully, Paul, you'll be able to get on to maybe somebody will drop out and you can get into that to an open slot or something, hopefully for your sake.
Right.
Yeah, thanks. Unfortunately, this wretched article in the paper has probably killed that, but I think they're going to do more trials on it later. I'm just looking whilst we speak at this conference here in a few weeks. There's there's Professor Jason Lewis from Memorial Sloan Kettering is one of the speakers. Professor Richard Weil from Washington University School of Medicine is looking at these sort of agents, particularly for imaging. So there are some people in the States who are looking at these things.
Good. Glad to hear that.
Indeed. Okay. Anything else from you, Paul Hobson?
No, you've had a fairly large update from me as to where I'm at the moment.
Okay, well, thank you for that. And Paul Frieda, I believe you told me that you wanted to speak tonight.
Yeah, I got a cold about 2.5 weeks ago, and it's still with me. And I've never had this much trouble kicking a cold. So I'm wondering if the reason is that my immune system is depressed because of the cancer. And my follow-on question is, does that mean that I probably should not get a flu shot because my immune system is weakened, or am I worrying too much?
Well, in my opinion, you should get the flu shot. What's that guy's name out at the PCRI conference? Mark Moyad, I think his name is. He's a big believer that you should get any kind of a prostate cancer patient should get any kind of vaccine that they can, because he believes all vaccines work to stimulate the immune system.
I see.
And yeah, and I mean, you could find out. I'm not sure if the flu vaccine is live attenuated virus or just dead virus. I'm not sure. So I mean, if that's a concern, I would definitely talk to your doctor. Probably your primary care doctor will do, or just ask the pharmacist. And most people around here where I live, they go to pharmacies to get the flu shot.
Oh, okay.
Yeah, the pharmacist would know.
Yeah, Paul,
Right. Good.
Probably, most likely, your doctor will not give you the flu shot until you've gotten rid of the cold, though. Mine always asks me, do you have a cold, or are you sick, or whatever, before they give you the shot.
Yeah, right.
Yeah, that's
And
true.
you
I
have to
believe
wait.
I've heard that. Mm-hmm.
And I don't know what this means, but I wanted to get a flu shot. I did get my flu shot when I went visited my regular doctor, but I also wanted to get my pneumonia shot. And she said to wait at least a month because the two of them fight each other or something when something to do with the immune system fighting each other when you have two shots at the same time. I don't know what that means. Maybe Len understands that, but I don't.
Mm-hmm.
Well, I hadn't heard that, but I'm not an expert on immunology, so your guess is as good as mine. That's something I guess we could Google and find out.
This is Jim Harrington. I know that the flu shot, the virus is dead. I just had a flu shot, and it's often it's also Snuffy Myers also recommends having it. I think it's a good idea to have it, but if you got a cold, maybe not. I mean, supposedly you cannot get the flu from a flu shot because the virus is dead. But I think it's a good thing to have. Maybe just check with your doctor, or just when you get over your cold and you shake it, go get a flu shot. There's plenty of time. But I'm absolutely convinced I get it. I get it every year, and it's often advocated by people like Snuffy Myers or Morad, as you say, to get it. Probably good advice, so I get it.
Yeah.
Okay.
I think it's a good idea.
Yeah,
Paul Hobson coming. Paul Hobson at the 2015 PCRI conference, I think was Charles Drake talking on immunotherapy. He also suggested that people with prostate cancer should go off and have as many vaccines as they could get, because they all kicked on the immune system.
I think that's right. I've had shingles shot, and I've had the pneumonia shot. I just take them all. I figured that ward it off the best you can, and I think it's a good idea.
Yeah.
No, you sound as though you've got tetanus and whooping cough to go.
Paul, how long have you had the cold? Paul Frieda.
Yeah, it's going on 2.5 weeks. I've never had this before. The way I got it, actually, we had a hurricane here in Florida, and I was a little concerned about my roof, so we went to the local hurricane shelter center and spent the night there. And there are 400 people there, and you're touching door handles and desks and things like that. And about 15 hours after I came home the next day, it started with a real bad sore throat, and then the sore throat went away, but I just had this head cold that and also turned into a cough, and it just hanging on. I just can't believe how long it's hanging on. Unfortunately, it doesn't not a lot of pain. It's not painful, but it's just a little worried that I've never taken this long to kick any cold. So
Yeah.
But in fact, right now you might even hear me sniffle a little bit. So I did go to the local medical place, and they gave me an antibiotic, which I'm starting to take now. So maybe that'll kill it.
Yeah, I was just thinking you might have a sinus infection, which is not an uncommon complication of colds, long lingering colds. Have you ever had a sinus infection before?
I don't even know. Well, I know what the word sinus and infection mean, but no, I didn't know that I had a sinus problem. So maybe I should look into getting a neti pot or something like that and clean that all out or something. I don't know.
Well,
I thought this is cold. I didn't realize that it could be something else.
Yeah. Well, the way they would normally treat a sinus infection is with an antibiotic, and it looks like they've already given you that. Maybe they were giving you the antibiotic just in case you did have a sinus infection. Because an antibiotic for a cold doesn't do any good at all, since the cold is a virus.
Right.
Right. Well, they swabbed my throat and determined that it wasn't a strep throat, which would have been bacterial. But
Right.
But anyway, he did give me the antibiotic, and I started it last night, and today I coughed much less. I think only one time. So I'm hoping that it'll go away. But my sinuses are still a little stuffy, and so maybe you're right. Maybe I got a sinus infection, and the antibiotic will kill it. Let's hope so.
Yeah, hope so.
Yeah. Well, an antihistamine might, if it's sinus, an antihistamine might help you feel better. It won't cure it, but it might help you feel better.
Yeah, I've got Dayquil and Benadryl, and I've been taking that when I felt like I needed it. Yeah.
This is just anecdotal, but whenever I go to of course I go to my oncologist once a month for my Zometa infusion, and if I have a cough or I have a sniffly nose, the next thing I know, the doctor and the phlebotomist are wearing masks, making me feel like a leper. It's not because they're afraid of people who are in worse shape, people who are on chemo or whatever have lower immune systems, so they're afraid of spreading the germs. But I feel like I'm in a leper colony suddenly because they all walk around with masks just because I happen to cough once.
Jake, you said the Zometa is given as an infusion?
Yes.
Uh-huh.
It's a bisphosphonate. It's actually I'm getting the generic zoledronic acid, but it's the same thing.
Right.
Supposed to keep the bone from weakening. It's similar to Xgeva, except Xgeva is a shot and given to you in your stomach.
Right.
And Zometa is an infusion given into a vein.
Okay, I didn't know. I've never been on either one, but I didn't know that Zometa was an infusion. I've heard Rick many times say that Zometa has a very, very long half-life, and that I'm surprised they feel it's necessary to give you the infusion every month. Has anybody else on the call been on Zometa, and do they give monthly infusions?
I'm on Xgeva. Is that what you're talking about, Xgeva? Is that the one?
No, that's a different drug.
Oh, that's not in your stomach. But it's supposed to be monthly. But I do it every month and a half.
I thought they gave it to you in your stomach.
No, that Xgeva is just in the arm. Before that, I was on Prolia, which was a 6-month shot, which is very similar to Xgeva. I really don't know the difference.
Actually,
but
I
they switched
think,
me to Xgeva.
yeah, I think Prolia is like Zometa in that it's a bisphosphonate, as Jake mentioned.
I think Xgeva is the same thing, though. I think
No,
that
no, no.
I don't.
Xgeva is a monoclonal antibody. It's a completely different medication.
Oh.
I mean, they give it for the same reason, but it's
Right.
completely different.
Oh, I see what you're saying. Oh, okay, okay.
Yeah.
Well, I haven't
I
lost
never
any
heard of
teeth
it being
yet.
given in the arm, though. I've always heard that you had to get it in your stomach. And
I don't know. I go and I get every month and a half, and no, it's given in the arm.
it's not bad at all.
But that's what's happening. You know, it's not so bad. The problem is you've got you're quite right. It is a monthly, well, shot, so to speak. But I guess it's sufficient to do it every month and a half, and then every 3 months I get the Lupron shots, so I can get them both on the 3-month cycle. But I don't seem to have any ill effects from Xgeva. It doesn't do anything to me. And I say I haven't lost my 2 teeth, but let's hope it's working.
Oh,
They
guys,
say it can. Yeah, go ahead.
I just need to correct myself. Prolia is actually the same as Xgeva. Denosumab.
That's what I thought.
Yeah, they're both monoclonal antibodies. Sorry about that.
Yeah. I don't know why they switched me off Prolia, but the nice thing about Prolia, it's a relatively new drug, I think, is that it's every 6 months. And for some reason he said, well, I'm going to switch to Xgeva, and he just didn't explain it. So I don't know. But I thought the Prolia was a pretty nice drug because it's every 6 months.
Sure. Better than month and a half.
Yeah, that's for sure, yeah.
And you're right, Lynn. And he's told me on numerous occasions that I probably get it too often. I had to take my oncologist at her word. I mean, I'm not the doctor, so I had to take her at her word. But she says I need it every month because I did ask her about it, and she said because it does have a slight anti-cancer effect, but the main thing is that
so I've heard. Yeah.
The main thing is that it remodels your bone.
Right.
To keep it theoretically to keep it from getting fractures or from
yeah that's what I've heard. Yeah,
there are side effects because like you said, if you some people get ONJ, the new I forget what it stands for.
Osteonecrosis.
Yeah, that's it. Osteonecrosis of the jaw.
Yeah. So I've heard. In fact, I've been on this call in the past. Somebody said the teeth just fell out, a couple or something like that. But yeah, that's a lousy.
Yeah, I think
deal.
there's a guy named Frank Kelly, possibly, who's on the call.
Oh.
He's got a very deep voice.
Yeah, it's possible. Yeah.
I think he's.
But so far, I haven't. But I do tell the dentists when they're working on me that I do take this, and just in case. And it hasn't done anything different, but.
Well, apparently the osteonecrosis of the jaw is apparently a relatively low.
Yeah, that's what I've heard. My dentist says it's rather rare to have this happen.
And the only time it's really a concern is if you have a tooth pulled. Maybe a root canal might be bad, but definitely a pulled tooth is when you're at risk. Just regular filling or whatever, it's not going to it should not be an issue.
Right, I've heard that too.
But Rick says that the Zometa has like a half-life of 2.5 years or something. It's ridiculously.
Yeah, ridiculous.
Yeah. But
there've been some recent studies that because of the half-life of these drugs, they don't need to be given as often, and I think people have recommended to sort of cut down the dose that's previously been given.
Yeah. Sometimes they just stick with whatever dosage schedule was used in the clinical trial when the drug got approved, and they never bother adjusting that, after years of clinical practice when they find it's not really necessary to have such a strong dose.
Yeah, I have mixed feeling. I mean, Rick is on top of all this stuff, and he does all the research, and he knows. Yeah. He knows the stuff left and right, and I take everything he says with great seriousness. But then when I go to my doctor, she kind of poo-poos a lot of the things. Says, "Oh no, that's you need to do this, you need to do that." So who do I believe? It's
Yeah.
I don't want to get her mad at me or to think, I don't want her to think that she's not, I don't think she's doing the right thing, because I think she is. She's kept me alive for 4 years.
Yeah. And she specializes in G
No,
medicine, oncology?
no, she's just a regular oncologist.
Regular. Well, you know Rick's opinion on
I know
that,
what Rick
right?
says about that too, yeah.
Yeah.
So, yeah, you're right.
I'm not going to say anything else.
No, you're right.
Yeah. So we lost Albert. I don't know. He said he was going to disappear for 5 minutes, but as far as I know, he hasn't come back.
Looks like he has something to do because he was eating before he left, or so
Yes.
I don't know.
Yeah, he was making me hungry too. So I guess, do we have anyone else who wants to chat about something?
Nothing from me, Glenn.
Yeah.
You did a good job. I appreciate it, and thanks for. We're a small but mighty group tonight.
Yeah, it's I find it a lot easier. I mean, I've never moderated before, but when there's just a small group, you don't have people talking over each other. And oftentimes, there are many times when I'd like to chime in, but then someone else jumps in. And it would be nice if the meeting software had a system where, you click on the little icon that says, I'd like to speak, and then the moderator can call on you one at a time. Recognize you and call on you.
Because you're right. That's a lot of times the same 3 or 4 people say something at the same time, and you don't understand any of them.
Exactly.
Or it would be nice if it automatically muted anybody that wasn't talking. Whoever talks first, then anybody else would get muted until that person stops. That would probably be something the software could do too.
Yeah, actually, I believe this software can. I believe I could mute everyone and then just unmute the person who wants to speak. But I think it's awkward because the guys will forget that they're muted, and they'll start speaking, and we won't hear them, and it can get even more confusing.
Yeah, right. But yeah, I agree with you, Len. I think the smaller group is actually better in some ways because I don't know. I feel more at ease talking with a few people than I do with 20 or 30, or not. We never had that many, but 10 or 15.
Yeah. Well, actually, we used to get around 20 when there was only one session, and then Rick split it into 2. He's got the Tuesday night and the Monday night call. Tuesday night's the earlier call, Monday's later.
Right.
So that also helped. Got knocked it down to about 10 or so.
I try to listen to both, but
yeah, I do too, but scheduling doesn't always allow it. But I know this core group that we have today, 90% of the time, I think we're all here.
Yeah, you're right. But I don't know who said it, but I think you did a great job tonight, Len. It was. I appreciate it.
Well, thanks, guys. I mean, I think, I wasn't contributing any more than anyone else. I think it was the group effort here made it a good session. Thank you all. And
yeah, thank you, Len, and thanks to everybody participating. And yes, it is nice to be able to talk a little bit more. And sometimes we're on the Monday calls. You get so many people that you're so far down the list that you can't even talk. Very good tonight.
Yeah. Well, we'll tell Rick to start up another session. Poor Rick. He dedicates his life to this stuff. He's amazing.
He really is. I admire the man. I mean, his energy and the time he did. Because it's not just the time he spends with us. It's he does research and he goes to these meetings and.
Oh yeah.
Yeah. And I think he still works, as far as I know. I don't know.
I don't believe he does. He's usually complaining about a lack of income. I mean, I think he has a rental unit, but other than landlord income, I'm not sure he does have an income. But
his efforts are really amazing, and I certainly appreciate them.
Me too.
He yells at me occasionally.
Yeah. He yells
I
at
know
all
he
of us.
doesn't. Yeah, he does.
For good reason, usually.
Okay. Well,
All right, guys, I am going to stop the recording now, and we'll say goodnight. And if Albert comes back, I'm afraid he'll be alone. But we get.
Yeah, thank you, gentlemen. I appreciate it. I may talk to you next week.
Okay, bye-bye.
good
bye-bye.
night, everybody.